Actually see if I push on the Nexplanon, you can see the tip there. So we will numb this area, make a small little incision here, remove that Nexplanon. So we're doing a removal and replacement. Remove that, and then we'll do a replacement. So first thing I'm going to do is I'm going to clean the area. So we want to make sure that the area is nice and sterile. First thing I'm going to do is I'm just going to inject the area where I'm going to remove this. So do a little wheel. Inject. And kind of go underneath here. Sorry, love. The reason I want to do this is, number one, we're replacing it, so I want to give her enough anesthetic so that we can remove it and then replace it. What I do a little testing just to make sure she's nice and numb. Do you feel that? You feel a little bit? Okay, so I'm going to wait a little bit. So I can see that the tip is right here. So what I'm going to do is kind of cold pressure and make a little stab incision here. I already made the stab incision, and you can see that the Nexplanon is right there. So I'm going to grab it and then just gently tease it out. There it is. And so some patients have asked if this thing can break. It's very flexible, as you can see. So some people are concerned that it's going to break. It's not going to break. So once we take this out, then we'll replace it. Now that she's numb enough, we'll replace it with a new one. So this is the insertion needle. I know it looks a little scary, but trust me, she's nice and numb. And what we want to do is we want to stay very superficial. As you could see when she first came in, you could actually very clearly see the Nexplanon. Some clinicians make a mistake of putting in this too deep, and you don't want to go too deep because then it makes it really hard when you're trying to extract it. So what I'm going to do is I'm going to follow the same path, and I'm going to just stay very, very superficial. You can see I'm kind of tenting up her skin. So I'm staying right underneath the skin. And I'm going as deep as this will let me go. I mean, penetrating as deep as it'll let me go, not penetrating through the skin. And then once I'm in there and this touches the hub there, then I can release the device and then pull this out. And the little Nexplanon is in there. I can feel it. Right now it's a little swollen because of all the numbing medicine that I gave her, but I can actually feel, you can even see the tip right there. See that? So it's nice and superficial.